Hi everyone, welcome to the channel. If you're new here, on this channel we discuss medical topics and lifestyle. Today's video is on pancreatitis. So everything you need to know about pancreatitis. We're going to go through causes, presentation, examination, management, complication. So everything you need to know about pancreatitis. Let's get right into it. So first thing is first, we need to go over some basic definitions and some basic anatomy. So the pancreas sits in the abdomen. It secretes digestive juices into the duodenum, which is the first part of the small intestine. Above that, in shaded in green, we have the gallbladder. So the gallbladder secretes its juices into the tubes or the ducts, we call them, and the pancreas secretes its juices into the ducts of its own, right? So the juices that are secreted by the pancreas go through the pancreatic duct or the main pancreatic duct, and they join the biliary duct called the common bile duct. And then they join up and they secrete their juices collectively into the first part of the small intestine, which is called the duodenum. In terms of the pancreas, there's a head, a body, and a tail. Some images display a neck as well, but that's generally how the pancreas looks like. And now we can move forward from here. For videos about the gallbladder, please make sure to check out our other video on gallstones. Gone over some basic anatomy and we talked about these juices that are secreted from the pancreas. Let's actually talk about what the pancreas does, right? So what does the pancreas actually do? So the pancreas has an endocrine function and an exocrine function. In the endocrine function side of things, it helps regulate blood sugar levels. So we'll make another video on that and the various topics related to diabetes, but that's what the endocrine side of things does. And in the exocrine side of things, which is what we're more concerned about in this video, that side of things aids in digestion. So it produces enzymes to help with digestion of food. One of these enzymes that is produced is called amylase. So this is a digestive enzyme that helps digest carbs. And this is one of the things we look out for in a blood test at your doctor's office that tells us whether somebody is suffering with pancreatitis. So when the amylase is high, then it's likely that pancreatitis is going on. So amylase is very important both physiologically for our bodies and also when we're doing blood tests as well, whether it be in the doctor's office or the hospital. Now, what is actually pancreatitis? So pancreatitis is premature activation of pancreatic enzymes leading to autodigestion. So basically, it's premature activation, pancreatic enzymes, which results in autodigestion and tissue damage. So it eats itself, basically. Most of these episodes of pancreatitis are mild and self-limiting, but about 20% can be, so 1 in 5 can be severe attacks, and it can be recurrent. So it's quite the problem when it happens. So we know what pancreatitis is. Now let's talk about the causes. So what causes pancreatitis? In about 10% of patients, there is no cause identified. So that's about 10%. So we have the remainder 90%, what we're going to talk about here in terms of causes. And then 80% is actually because of alcohol and gallstones. So those are the two biggest causes of pancreatitis. So 80% alcohol and gallstones. Then we have the remaining 10%, which are more rare causes, which can be anything from drugs to trauma to scorpion stings to steroids to viruses and all these kinds of things. So there are a lot of different kinds of causes that can be a bit more rare, but there is a way of remembering it a little bit better in terms of a mnemonic. If in case you just want to know it in your mind a little bit better, or you're studying for an exam or something like that. We'll get to that in a moment. But basically, the important thing here is that 80% is caused by alcohol and gallstones. So as you can see, two very, very preventable things here. An easier way of remembering it is with a mnemonic called get smashed. So get smashed, gallstones, ethanol, trauma, scorpion stings, mumps, autoimmune disease, steroids, hypercalcemia or hypertriglyceridemia, ERCP, which is a procedure that you undergo to remove gallstones or to examine the biliary tree, and also drugs. So get smashed. If you have pancreatitis and you present to the doctor's office, what are going to be the signs and symptoms? So, abdominal pain is the main feature here. So it's poorly localized, continuous pain, boring pain. It'll increase over time. It'll often get worse if you're laying down, and it can radiate to the back as well. So this is the feature of abdominal pain. Now, there are other symptoms, of course, that can happen. So you can have nausea, vomiting. You can be a little bit more unwell in terms of having tachycardia. So your heart rate can beat very fast. You can have a fever. You can have shock, and you can also have jaundice as well. So this is the typical picture of pancreatitis. When it comes to the examination part of things, so the doctor will find that your epigastric region is tender, but sometimes the whole abdomen can be tender as well. The doctor may also see that there's some abdominal distension, so the belly blows up. There's decreased bowel sounds, and in rare cases, you can even have retroperitoneal hemorrhaging, which is bruising, like these bruised apples here, in the flank area and in the periumbilical area. So bruising in these two areas are a rare um, sign of acute pancreatitis. Now we move on to the management side of things. How do we treat acute pancreatitis? So pancreatitis is actually a worrisome thing. So in most cases, it's an emergency. So we actually need to go to the hospital for this. There isn't really much we can do in the community apart from arrange transport to the hospital if you need it and give you some painkillers. In the hospital, you'll get a combination of painkillers like morphine. You might get some antibiotics along with a lot of fluid to help keep you hydrated. What I would be more focused on is actually preventing pancreatitis from ever happening, so the prevention side of things, because we can influence that in the community and in our own homes. And what I mean by that is to avoid the things that cause pancreatitis, like drugs, alcohol, gallstones, so aiming for a low fat diet and things like that. So prevention is actually the key here. Finally, we can cover some complications of pancreatitis. So if there's a chronic pain or something lingering on that we have a hunch that it's related to the pancreas, then there might be complications there. Pancreatic necrosis can be a thing. You can have a pseudocyst forming, which is a collection of fluid um, of pancreatic secretions. There may be fistulas or abscesses forming. You could also have bleeding, thrombosis, in addition to pancreatic insufficiency, so where we might need aid further down the line of digesting and help of digesting our nutrients because the pancreas is insufficient in doing so. These things can sometimes be tackled with medication that you can get from the doctor, but in reality, prevention is the most key thing here. So diet, meaning low fat, high protein, pancreatic enzyme supplementation, like I mentioned, can be a thing. Abstaining from alcohol, though that's very important. Pain control, so providing painkillers, and just management overall of any complications that may arise from pancreatitis. So there we have it, everything you need to know about acute pancreatitis. I hope you enjoyed the video. Like and subscribe for more. Leave a comment in the section below for further topics you'd like us to cover, and we'll see you in the next video.